Where we were, I was on a phone call yesterday with major county executives and the governor. And while he didn't reveal anything about what you're going to hear later this afternoon, they were still in the process of discussing it. What he did emphasize for us was that he was leaving it to local jurisdictions to make decisions about how far to open, and that we wouldn't need to ask for a waiver, we wouldn't need his permission, nobody would have to declare they were defying the governor, that we will make the best decisions for our jurisdictions. And he understands that. He acknowledged that the situation in some parts of the state is dramatically different than it is in our more urban counties, and that we need to do the right thing based on what we know about the science and the conditions that are local. So we were on with, Montgomery County, Prince George's County, Frederick, Howard, Anne Arundel, Baltimore County, and Baltimore City. And we were all pretty much asking for the same thing. We all feel that we're more vulnerable, and we've got caseloads that are still growing, and that we haven't seen, the trend lines that were put out originally by the CDC, now nowhere to be found, except by people who captured screenshots of that in the old days, and also by the governor himself when this process started. And so we're still trying to adhere to those guidelines and make sure when we open that we're reasonably safe. I have emphasized this over and over again. There is no value in opening prematurely if it plunges us right back into this crisis again. And I think what we've got to keep emphasizing for people is that you don't know who's infected. And so to just open up the way we were before until we have much better knowledge about the spread of the COVID virus, and we've been able to identify more of the people who have it, would be putting everybody at risk. And I think the jurisdictions, collectively, myself, Angela, Muriel, and the others, that we all recognize that we depend on each other. Our borders are way too fluid. There's so much traffic and activity that goes back and forth that if one jurisdiction were to do something before other jurisdictions did it, we run the risk of creating what you would call in another circumstance an attractive nuisance. And we don't need everybody going to the first mall that opens or the county that has the first restaurants that are open, because we run the risk then of either bringing cases into that county or bringing cases home from that county. So we need to work together. We need a coordinated plan. I think, we've been talking about this for a while, and we're going to keep working together. And my hope is that we can all come together and that our caseloads begin to decline at the same pace across the region, and we'll be in a better place to open up. So we'll see what the governor has to say, but I think the good news is that we're going to be able to continue to make our decisions based on science, and the governor actually expects us to do that. So we are not going to be in a conflictual situation with the governor. That's the most important thing, I think, for all of us. And I think he's going to send that message. We are at almost 400 deaths now. That's almost a 100-person increase since last week. Deaths may go down slower than cases, or at least the percentage of deaths, because if you're sick and in the hospital, that doesn't change. That's not the same metric as how many people in the community have cases. And so we're looking for a reduction in cases. I see that DC extended their stay-at-home order till June 8th today. That is probably a very sensible decision. And, the governor has decided to keep Northern Virginia closed until May 29th. And we'll see. I hope everybody keeps revisiting these decisions as we look at caseloads and start approaching these dates. That's the important thing. You can't set a date and have the date be the most important thing. The most important thing is what happens to the caseloads. And if the caseloads indicate that that date is the right date, you should do what you were going to do. And if that date's the wrong date, you need to modify your date. Health needs to rule this decision. We're going to continue to emphasize the importance of physical distancing between people, wearing face coverings, and sheltering in place. And we know that our sheltering in place order has exceptions. So you can go to the grocery store, the hardware stores, people go to Best Buy. And so this is, it's obviously a modified form of a sheltering in place. What else? We are busy scaling up our test capabilities, because that's one of the critical things that we know we need, is to be able to test more people. We have signed contracts with people who can provide us more testing. We are not buying test kits. We tried to go down that path before and discovered the same thing the governor did. I could have bought kits, and I could have bought kits that were either incomplete or that didn't have machines locally that had the throughput to actually process the kits. So we're contracting with some local companies in our bio sector here in the county that have capacity both to provide us testing instruments and the capacity to actually run those tests and provide us rapid results, which is something that's important to all of us. We will be able to, I hope, offer mobile testing sooner than later. We've talked about bringing our testing out to the grocery stores and the Home Depots of the world, because we want to be able to test frontline workers there, as well as our own frontline workers, all the police and fire folks who are out there, the people who are doing home visits for child protective services, or serving the public in other ways that we've kept open. We've tried as best we can to keep services as normal as you can do in an abnormal time. So we've tried to maintain as much open as we possibly could do this, and we're going to continue to do that. We are continuing to work with nursing homes, and Dr. Gales can talk more about that. And we're glad that the governor is setting up strict guidelines. This nursing homes are regulated by the state, and we're glad that the governor is paying a lot of attention to the nursing homes right now.